Everyone, before we get into today's video, I want to ask you something honestly. When was the last time your partner truly felt satisfied? Not just going through the motions, but deeply, completely satisfied? If you had to pause and think about that, you're not alone. And that's exactly why we're here today. I'm Dr. Ava Remington, a specialist in urology and sexual health with over 20 years of clinical practice right here in the United States. I've worked with thousands of couples in my career, men and women, mostly over 50, and I can tell you without a shadow of a doubt, the most common issue I see in my office isn't physical. It's that nobody ever taught us how to really use our hands. Not in health class, not anywhere. Today, I'm going to walk you through that step by step. We're talking about manual technique, what works, why it works, and how to do it with confidence, patience, and care. Stick with me until the end, because the final steps are the ones most people never figure out on their own. Now, before we dive in, if this video is useful to you, hit that like button and subscribe to the channel. Drop a comment below and tell me what city or state you're watching from. I love knowing where all of you are tuning in from. All right, let's get into it. I want to start by addressing something I hear in my office all the time, especially from men over 50. Guys come in and they say, "Doc, I don't know what happened. Things used to come naturally and now I feel like I'm starting over." And sometimes they carry a lot of shame about that. Let me be clear, there is nothing wrong with you. The body changes, relationships evolve, and learning new skills at 55 or 65 or even 70 is not a sign of failure. It's a sign that you actually care. That right there puts you ahead of most people. A 2023 study published in the Journal of Sexual Medicine found that 68% of women over 50 said they valued emotional attentiveness and a gentle, thoughtful approach far more than speed or intensity. Think about that. 2/3 of women are literally saying, "Slow down and pay attention to me." And yet, most men were never taught how to do that. That's not your fault. That's a gap in education. And today we're filling that gap. Now, I also want to speak directly to something that came up in a conversation I had with a patient from right here in the States, a retired professor from Nashville, late 60s, prostate issues, on medication for BPH. He said, "Dr. Remington, intimacy for me now looks completely different than it did at 40. I just want to give my wife something real, something that actually connects." And that broke my heart in the best way, because that desire to genuinely connect is exactly the foundation of everything I'm about to teach you. So let's talk about the hands. Why are they so powerful? Your fingers are honestly one of the most sophisticated tools in the human body. They can adjust pressure with precision. They can change angle instantly. They can work with one finger or two or three, depending on the moment. No other part of your body gives you that level of control. But for that control to actually work for your partner, two things have to be in place: consent and preparation. These aren't just nice to haves, they are the foundation. Without them, everything else falls apart. Consent means asking out loud every time. I know that might sound awkward if you've been with someone for 20 or 30 years, but here's the thing. Asking actually makes things better. It doesn't break the mood, it creates safety. And when your partner feels safe, her body responds completely differently. Her pelvic floor relaxes, blood flow to sensitive areas increases, and sensations become significantly more intense. Asking is foreplay. Don't skip it. Something simple like, "Is it okay if I touch you here?" goes a long way. And I want to encourage all of you, especially those of you dealing with some anxiety around intimacy, whether that's from past experiences, health issues, or just time and distance. Don't underestimate how much those few words can reset the entire dynamic between you and your partner. Now let's talk preparation. I know this sounds clinical, but bear with me because it matters more than you think. Trim and file your nails until they are completely smooth. No rough edges, no sharp corners. The tissue in sensitive areas is delicate. One small scratch can end the whole experience and break your partner's trust in the process. Wash your hands thoroughly with warm water and soap, getting under the nails, remove any rings or jewelry. And if there's any chance of dryness, which after 50 is very common due to hormonal changes, keep a water-based, fragrance-free lubricant nearby. Not because something is wrong, but because it's a simple, thoughtful gesture that makes everything more comfortable and more enjoyable. I had a couple from Phoenix, Arizona, married 34 years, come into my practice a few years ago. The husband had started paying close attention to these small details. Clean hands, trimmed nails, a little lube on the nightstand. His wife told me later that those gestures made her feel genuinely cared for, in a way she hadn't felt in years. That's not a small thing. That is the foundation of emotional intimacy. And here's what I want all of you to understand about that preparation. It's not just about hygiene or safety. When you take those steps, you are communicating something to your partner before you've even touched her. You're saying, I thought about this. I prepared for you. You matter to me. That message lands deep, deeper than any technique I could ever teach you. When your partner feels truly seen and respected, her entire nervous system relaxes, pelvic floor tension releases, blood flow increases, and the experience becomes something entirely different than what most couples settle for. That is your first real breakthrough in this video. Remember it. In the next section, we're going to get into the actual steps, how to build anticipation, how to start, and how to read your partner's signals so you always know exactly where you are. All right, let's get practical. The number one mistake men make is going straight to the destination. The body doesn't work like that, especially for women over 50, and especially in longer-term relationships where some emotional distance may have built up over the years. You've got to take the scenic route, not because it's a rule, but because that route is literally where most of the pleasure lives. Step 1, warm up and anticipation. For most women, arousal isn't a switch. It's a slow build that involves the whole body. So start somewhere unexpected. Run your fingertips along her neck. Trace the curve of her shoulders. Press gently along the lower back. Kiss the inside of her wrists, the collarbones, the places that don't usually get attention. These aren't just sweet gestures. They're neurological signals. Gentle touch in those areas triggers oxytocin release, the bonding hormone, and gradually increases sensitivity throughout the whole body. A 2024 study from the Kinsey Institute found that slow, attentive touch in non-genital areas not only increased relaxation, it also significantly heightened sensitivity in erogenous zones later in the experience. You're not wasting time during warm-up. You're investing in what comes next. As you move toward the inner thighs, slow down even more. Place your palm gently over her pubic area, over her clothing, for just a few seconds. No pressure, just warmth and presence. Then trace the waistband of her underwear with your fingertips. Light, playful pressure. Like you're drawing a map you already know but want to explore all over again. You can also use a natural massage oil here, something like sweet almond oil instead of a standard lubricant. The texture's different, more sensual. And the warmth of it on the skin adds a whole new layer of sensation. The goal right now is to build anticipation until it's almost unbearable in the best possible way. Every stroke you add is like fuel in the engine. Don't rush to ignite it. I think of a patient I worked with, a retired contractor from Austin, Texas, early 60s, who came to me frustrated that his wife seemed disconnected during intimacy. After we worked through this warm-up approach, he called me 3 weeks later and said, "Doc, I feel like we're dating again." That's the power of patience. Don't underestimate it. Step 2, external touch. Pause, slow and deliberate. Once you sense that she's responding and her breathing has deepened, she's moving slightly toward you, her body has relaxed, you can move toward more specific external touch. If her underwear is still on, that's fine. You can still work with that. Gently touch the outer labia through the fabric, light feather-like movements along the inner thighs. When she gives you the green light for direct contact, slide one finger along the outer labia, then the inner labia. Don't go straight for the clitoral glands. This is extremely sensitive and can actually feel uncomfortable or even painful if you go there too quickly. Instead, make slow circles around the clitoral hood. Vary between very light movements and slightly more deliberate oval strokes. Watch her. A soft exhale, a slight hip movement, a change in her breathing. Those are your signals. Those are your green lights, not a verbal announcement. You learn to read those signals by paying attention. Use a lubricant here if needed. A small amount applied gently keeps everything fluid and comfortable. A 2024 study from the European Journal of Sexual Health found that 70% of women over 50 appreciate extended external stimulation before any more direct touch, specifically because hormonal changes affect both sensitivity and moisture levels. This isn't about going slow because you have to. It's about going slow because it works. A practical tip: alternate between using your fingertips for precise, targeted touch and the palm of your hand for broader, more relaxing pressure. Both feel completely different. And keep asking, just small, natural check-ins. Does that feel good? Slower or a little more pressure? These questions don't interrupt the moment, they deepen it. They tell your partner that you're fully present with her, not just going through a script. Stay with me because in the next section, we're going into specific rhythm techniques, and I promise you, this is the part that changes everything. Step 3, building a rhythm around the clitoris. Every woman's sensitivity is unique, but research consistently shows that most women, especially over 50, respond far better to consistent rhythmic touch than to anything fast or unpredictable. Your goal here is to find a rhythm and hold it, not to impress, not to escalate, just to stay there and let the sensation build. Start with gentle circles around the clitoral hood. Avoid direct contact with the glands itself for now. It can be too intense, especially early on. Then experiment with vertical strokes, gliding slowly from the mons pubis down toward the vaginal opening and back up. You can also try horizontal movements, lightly grazing the sides of the hood. Use 1 or 2 fingers for precise contact. If she prefers broader sensation, 3 fingers in a slightly cupped position can work well too. Ask short, low-key questions. More or less pressure? A little faster? Higher or lower? These are not interruptions. They are invitations to co-create the experience with you. A 2023 study published in the European Journal of Obstetrics and Gynecology confirmed that 75% of women over 50 require more time to reach optimal arousal due to hormonal shifts. But the same study found that consistent rhythmic stimulation can significantly amplify sensation, sometimes beyond what they experienced in their 30s and 40s. That's not me hyping things up. That's science. Pay attention to her body language. Faster breathing, hips lifting slightly, soft sounds. Those are your confirmation that you found the right rhythm. When you find it, don't change it. That's the mistake. I've had so many men tell me they thought they needed to keep escalating, keep switching things up. And every time they did, their partner got pulled back from where she was. When it's working, stay there. The rhythm is the technique. Step 4, when and how to move inside. Natural lubrication is a signal of arousal, but it doesn't automatically mean she's ready for internal stimulation. These are 2 different things. Always ask directly, do you want me to go inside? If the answer is yes, and only if, make sure you have lubricant ready if needed. Post-50 hormonal changes commonly cause vaginal dryness, and using lube in those moments is not a problem. It's consideration. Begin with 1 finger, moving slowly toward the vaginal opening. Pause just inside the entrance to allow the pelvic floor muscles to relax around you. Then use a soft, gentle come here motion, curling toward the front wall of the vagina rather than in and out thrusting. Your fingers excel at precision and angle. Use that advantage. If you feel any tension or resistance, ease back. Don't push through it. Return to external touch. Breathe together. Let things settle and try again when the moment feels right. A small pillow placed under her hips can help with positioning. It shifts the angle just enough to make contact more natural and comfortable. I recommend this to almost every couple I work with. It's a small change that makes a significant difference. Step 5, finding the anterior sensitive zone. About 2 to 3 inches inside, along the front wall of the vagina, you may feel a slightly textured or spongy area, commonly called the G-spot. This region becomes more pronounced with arousal. Use a slow, gentle, come here curl toward this area and begin with very light contact. Don't force it. Don't rub aggressively. Just subtle pressure, short, gentle movements, and watch closely for response. A 2024 study in the Journal of Sex Research found that combined stimulation of this area using a patient, attentive approach can intensify pleasure for about 60% of women over 50. But here's the key thing. Not every woman is sensitive there, and that's completely normal. Don't treat it like a target you have to hit. Treat it like a place you're gently exploring together. While one hand works internally, keep the other hand active. Rest it on her hip, stroke the lower abdomen, or use your thumb to maintain gentle external stimulation around the clitoral hood if she responds well to dual stimulation. The combination of internal and external contact simultaneously, when she's ready for it, is often described by my patients as a completely different level of experience. A couple from Denver told me that discovering this coordination after 28 years of marriage was, in their words, like finding a whole new room in a house we thought we knew everything about. Stay with me for the final section because what comes next, coordinating everything together and understanding what to do at the very end, is the part that most people never learn, and it makes all the difference. Step 6. Coordinating 2 fingers with external stimulation. When she's fully aroused and ready for more, you can transition to 2 fingers internally, but move carefully. Angle your hand naturally, lubricate well, and keep both fingers together as you enter. Maintain that gentle anterior curl rather than switching to a pumping motion. The smaller, more precise movements are almost always more effective than anything dramatic. Now combine this with external stimulation. Use your thumb or your free hand to maintain a gentle, steady rhythm around the clitoral hood while your fingers work internally. The key word here is consistent, small, steady movements. Don't let the excitement of the moment push you into escalating too fast. The more aroused she becomes, the more your consistency, not your intensity, becomes the driving force. A couple I worked with from right outside of Chicago, married 31 years, the husband in his early 60s dealing with some confidence issues after a health scare, told me that learning this coordination was a turning point for them. He said, "I stopped thinking about what I was doing and started paying attention to her. That's when everything changed." That's exactly it. When you shift from performing to listening, the whole experience transforms. A 2025 study confirmed that combined stimulation can significantly amplify oxytocin release, which means it doesn't just feel better physically. It deepens the emotional connection between you. You're not just doing something to her, you're creating something with her. Keep checking in. Does this feel right? Want me to stay here? Small questions, big impact. Step 7. Adjusting near the peak. As she gets close to climax, her body will send you clear signals. Her hips may lift, her breathing will accelerate, there may be soft sounds, or her thighs might tremble slightly. When that happens, and this is the most critical instruction in this entire video, do not change what you're doing. I cannot stress this enough. I've heard from hundreds of women over the years who said the same thing. They were right there, and then their partner switched something up, changed the rhythm, added pressure, tried something new, and it was gone. The moment dissolved, and it's genuinely hard to get back. When you find the rhythm and pressure that's working, lock it in. Stay constant. Think of it like holding a signal. The second you move off frequency, you lose the connection. Consistency in those final moments is more powerful than any advanced technique. A woman I treated from here in the Northeast told me that after her husband finally understood this, just staying steady, not changing a thing, their intimacy became something completely new. She said, "He stopped trying to impress me and started just being there with me." That made all the difference. Step 8. Post-peak care. After climax, your partner's body is in a very sensitive state. Ease off the pressure gradually. Don't pull away suddenly. Keep a gentle, light touch, maybe a slow stroke along the thighs or lower abdomen. Hold her. Many women want to feel held more than anything else in those moments. Offer a glass of water, bring a warm towel. These are small gestures, but they speak volumes. They say, "I'm still here. I'm still paying attention to you." A 2025 study emphasized that post-intimacy care reduces stress hormones and strengthens emotional bonding, particularly significant after 50, when emotional connection in relationships tends to carry even more weight than it did earlier in life. And later, when things are relaxed and easy, ask her a simple question. What did you enjoy most? That answer is your roadmap. Write it in your memory. Use it next time. The couples who do this, who actually debrief gently and openly after intimacy, consistently report deeper satisfaction over time than couples who don't. It turns a single experience into an ongoing, evolving connection. A couple from right outside of Seattle, together for over 25 years, told me that starting these conversations after intimacy was the single biggest change they made. They said it was awkward the first couple of times, and then it became the best part of their week. Now, before I wrap up, I want to speak directly to the men in this audience who are dealing with something a little harder than technique. Some of you may be managing health conditions, BPH, prostate issues, cardiovascular medications, diabetes, things that affect sexual function in real significant ways. Some of you may have experienced performance anxiety that started to feed on itself. Maybe you've had one difficult experience and now the fear of repeating it is actually causing it to repeat. I see this constantly. You're not broken. You're not failing. What you're experiencing, that sudden loss of erection when you feel emotionally disconnected, that racing heart when the pressure builds, that is a physiological response to psychological stress. It is real. It is treatable. And the first step is exactly what this video is about. Shifting your focus away from performance and toward connection. When you stop trying to perform and start trying to connect, the pressure changes. And when the pressure changes, often the body follows. If you're dealing with this, please talk to a doctor. Not because something is permanently wrong, but because you deserve real answers, not just workarounds. And if your situation involves medication that affects function, there are options, adjustments, alternatives, complementary approaches. Don't just quietly accept it as your new reality without exploring what's actually possible. Let me bring this all together. Using your hands with patience, precision, and genuine care can transform your intimate life regardless of your age, your health history, or how long it's been. The techniques we covered today, warm-up and anticipation, external touch, clitoral rhythm, internal exploration, coordination, staying steady near the peak, and post-intimacy care. These aren't tricks, they're skills. And like any skill, they get better with practice, attention, and a willingness to keep listening. The best lovers aren't the ones who've memorized the most techniques. They're the ones who pay attention, who ask questions, who stay present, who care more about their partner's experience than about their own performance. That's it. That's the whole secret. Whether you're in your 50s or 60s or beyond, whether you're in a long marriage that needs a reset or a newer relationship where you're still learning each other, this approach works because it's built on something that never gets old, genuine attention and care. If this video helped you in any way, please give it a thumbs up and subscribe to the channel. Leave a comment below. Tell me where you're watching from, what resonated, or what questions you have. I read every single one. Our next video is going to cover natural approaches to supporting sexual health and addressing common conditions like BPH and hormonal changes in men over 50. So if that's relevant to you, you won't want to miss it. And remember this, sexual health is not a taboo. It is a real and important part of your overall well-being. You deserve to talk about it openly, get real information, and experience genuine connection at any age. Thank you for being here with me today. Keep exploring, keep communicating, and take good care of yourselves and each other.